So it gives me great pleasure now to introduce you to Dr. Danielle Macdonald, and her talk is Nurses and Midwives, Sharing the Humanity of Birth.
Does birth excite you? Do you enjoy hearing birth stories? Or do you try to avoid birth as a topic of conversation at all costs? What is it about birth that evokes such strong responses in all of us? My fascination with birth started when I was a child. I was the precocious 10-year-old asking the women in my life about their birth experiences. How did it feel? Who was there? Did it hurt? I was the teenager that heard a heartbeat with a fetoscope on a student placement with a midwife. And I became the registered nurse who loved supporting people with breastfeeding in the middle of the night. I'm still a registered nurse, and now I'm also an assistant professor at the School of Nursing here at Queen's University. My research explores global birth experiences. I still want to know what birth and birthing care is like. I want to know what women and birthing people experience during birth. Now, I use the term birthing people, and it may be new to you. I use it because not every person who births identifies as a woman. I'm also interested to know how families, nurses, midwives, and other healthcare providers experience birth. So why is it important to know about the experiences of birth? After all, if the birthing person and the baby are both healthy, the birth has been a success, right? Well, healthy can be defined in many ways. And in many places, healthy simply means not dead. But isn't survival a low bar to define success? Especially when we know that birth experiences influence parenting, future births, and the ways that healthcare providers practice? It seems to me that we are stuck. We are stuck in systems that focus on surviving birth. We can see the beginning of this focus start when we educate future healthcare providers. Nursing, midwifery, and medical students, when they're learning about birth, they're often introduced to the 4 Ps. The 4 Ps, for those that don't know, refer to the passenger, the baby, the passage, the pelvis, the powers, how the uterus is working, and the psyche, the birthing person's state of mind. When these elements work well together, we can be pretty certain that the birthing person and baby will survive birth. When these things do not work well together, there can be cause for concern because survival may be threatened. Now, the 4 Ps are helpful, especially for students who are learning how to organize labor assessments. They help us to understand how labor is progressing and to identify potential complications. But what happens to birth experiences when a birthing person, their body is segregated into body parts, to the functionality of their uterus, the shape of their pelvis, and the size of their soon-to-be-born baby? Birth is a sacred event, and it's influenced by the persons who are there. When we focus on body parts, we often exclude another word that begins with P, personhood. We're so focused on surviving birth that we lose sight of the persons who are there. Negative birth experiences happen when we focus on body parts and not personhood. Mistreatment in birth happens more often than most people realize. In many places, birthing people experience physical abuse. They don't have a choice in their birth companion. They lack privacy, and they're subjected to medical procedures without their consent. Nurses and midwives also have negative experiences providing birthing care. And those are often linked to staffing shortages, moral distress, burnout, and a lack of resources. To change this, we need to embrace personhood. And we can do this by learning about experiences of birth. You know, we don't often talk about the experiences of the people that provide birthing care. To understand this more, I conducted a study to understand how midwives and nurses collaborated in Nova Scotia. Midwives, as primary care providers, are experts in low-risk pregnancy and birth. They provide care throughout pregnancy, birth, and the following 6 weeks. To be a midwife in Canada, you need to complete a 4-year midwifery degree. Nurses, like midwives, also complete a 4-year degree, and we provide nursing care throughout the perinatal period. It's really important to know that in Canada, you do not need to be a nurse to be a midwife. Both professions require a license to practice. Nursing and midwifery are separate professions in Canada. Yet our histories are intertwined, and this contributes to ongoing tensions between nurses and midwives. I can remember when I was a newly licensed nurse, and a senior nurse scolded me because I was vocal about wanting and needing more midwives. She told me to be careful about who I associated with, because not all midwives were to be trusted. I hope she sees this tape someday. Seriously though, tensions between people impact birth experiences. So I wanted to know how nurses and midwives work together. I interviewed nurses, midwives, mothers, administrators, and a care provider. Participants talked about how midwives and nurses negotiated their roles and practices. Claire was a mother who had a midwife and a nurse at her home birth. She described how the midwife and the nurse traded off different tasks. Their clear communication with her and with each other meant that she felt comfortable, confident, and encouraged during her home birth. Participants also talked about how they sustained their working relationships. Elizabeth was a midwife who talked about wanting more opportunities to work, learn, and do research with nurses. But she described how this was difficult because there weren't a lot of resources to support more opportunities. The participants also talked about the tensions between the midwifery model and the medical model of care. Florence was a midwife who talked about how hospital births with nurses were the best kept secret because midwives and nurses loved sharing birth work. They knew that the ways that they shared birth work challenged the way that things were done, so they protected it by keeping it a secret. Participants also described their visions for midwife and nurse collaboration. Bridget was a nurse who talked about how she dreamed of a model of care that was led by midwives and supported by nurses. She described her dream of a birth house in the community, staffed by midwives and nurses. She wanted birth to be celebrated as a normal rite of passage in the community. Overwhelmingly, the participants described collaboration between midwives and nurses as an ongoing process that was mostly working well. But the aspect of this research that really stood out for me was how midwives and nurses collaborated in person-centered ways. That is, they extended the same respect, kindness, and care that they provided to birthing people and their families to each other. This meant that the birthing culture was changing. Midwives and nurses were flourishing. They wanted to work together. And the birthing people and administrators could see that change. The person-centered ways that midwives and nurses collaborated was leading to mostly positive birth experiences. So why is it important to know that midwives and nurses are collaborating well? We are facing significant global shortages of nurses and midwives. According to the World Health Organization, we will need 9 million more nurses and midwives by 2030. Increasing rates of burnout and attrition, pay inequities, and systems that do not value the contributions and voices of nurses and midwives are accelerating these shortages. We need radical change. We need experiences of birth that inspire us as healthcare providers, empower the birthing people and families that we provide care to, and facilitate person-centered birth. One way to initiate more person-centered approaches to birthing care may be to introduce nursing students to midwives. Opportunities to learn with and from midwives may support collaboration and positive birth experiences. We are so fortunate here at the School of Nursing at Queen's University because nursing students in this program have opportunities to learn with midwives. Between 2015 and 2020, about 35 nursing students have had clinical placements with midwives in the maternal and child nursing care course. I was so excited about this initiative when I arrived here at Queen's almost 2 years ago. After conversations with a nursing colleague who teaches the course and a midwife who's here, who has been a clinical preceptor, we decided to explore it further. We're just beginning a study to interview former nursing students and midwife preceptors about their experiences of these clinical placements. Understanding these experiences can help support interprofessional education and collaboration. Birth is a profound event. It's a rite of passage that many of us are a part of. When birth is person-centered, that is, when all persons involved in birth can flourish personally and or professionally, then our experiences will be positive. I'd like to share a personal story that regularly reminds me of the impact of birth experiences. Every year, on December 27th, I have the same conversation with my mom. She describes her experience of my birth something like this. You know, we had family over when I was in early labor with you. Eventually, I had to tell your uncles to go home because I needed to focus. We waited for your father's piece that he filmed to air on the late night news before we went to the hospital. Shortly after I was admitted, the physician who lived nearby walked over to reassure me that he would be there in time for the delivery. I can remember being nicely settled into the room when a resident came in and suggested that I should get up and go for a walk. I told him I was just great where I was, thank you, and suggested that he go for a walk. Closer to the delivery, I remember your dad. He said he wasn't feeling very well, and the nurse told him to go and sit down because the nurses hadn't lost a father yet. Shortly after you were born, you were taken to the nursery. That's where all the babies went to be weighed and bathed. I knew one of the nurses who worked in the nursery, and she decorated your bassinet with your name and ribbons everywhere. No other baby had a bassinet like that. I remember the nurse who helped me with breastfeeding. I thought she knew everything, and I was so grateful for her support. You know, there was a huge snowstorm the day you were born. And despite the terrible weather, your grandparents drove an hour and a half, both ways, to meet you, their first grandchild. The director of nursing also visited me in the hospital. She was from my hometown. She wanted to know if I would have help when I was discharged home. And I told her that my mom and my aunt were coming. And we both had a bit of a giggle because we knew with them there I'd have a hard time getting my hands on you. We can see that in the story my mom shares about her experience of my birth, that the people, her family members, my father, the physician, a resident, the nurses, my grandparents, and I were all important. We know they were important because more than 40 years later, they still have featured roles when she talks about it. Birth experiences have lasting impact because they're shaped by people and we revisit them in our memories. Positive birth experiences are important. Birthing people and families leave births feeling empowered, a feeling that supports healthy family transitions. Positive birth experiences are also important for healthcare providers because they leave births feeling professionally fulfilled, and this may help to address the shortages of nurses and midwives. Person-centered birth makes positive birth experiences possible for everyone. Thank you.